Hello, everybody, and welcome. I am Dr. Andrew Neville, and we're getting ready for our live Q&A. I've got a big list of questions from a bunch of different people, which is fantastic. I appreciate that. We're going to talk about everything and anything that is adrenal fatigue and what it's connected to. Adrenal fatigue being, probably one of the most misunderstood conditions that's out there today, yet one of the most common conditions that's out there today. Unfortunately, people just don't know they have it. They don't understand it. There's a ton of misinformation out there about it. But adrenal fatigue is connected to numerous symptoms that are affecting a lot of us in really significant ways. Could be anxiety, could be depression, but it could be fatigue, it could be debilitating fatigue and pain and weight gain and brain fog, getting sick all the time, having a ton of digestive problems, hormonal problems, both thyroid and reproductive hormones, you name it, mitochondrial dysfunction, neurotransmitter problems. All of this can be connected at a causal level to this thing we call adrenal fatigue. So we're gonna talk all about that. Now, I've got a few housekeeping things to go into. As you join in, please let us know where you're from. We've got patients all over the country. Thanks to this virtual medicine thing, we're able to help a lot of people all over North America, but we've even launched some international programs. So we've got some people internationally. So let us know where you're from. We're always curious about that. This conversation is for informational purposes only. Of course, I am not your doctor. I can't give you specific medical advice. You should always go to your local physician and talk things through before changing any of your protocols or instituting anything. But I will do my best to answer your questions based on my 20 plus years in dealing with this with many thousands of patients at this point. Now, we have come to see that a lot of my current patients will attend these sessions as well. And if you have this conversation is more so for the public, right? But if you do have a question and you submitted a question, I'll try to answer it if I have room kind of at the end. But if I don't get to your question, if you're in one of my programs, just reach out to the coaches to get that question answered, or wait for one of our sessions, office hours or coaching hour as well. And let me see if I missed anything here. So what I'll say and I'll share with you is what I found to be really crucial for healing from adrenal fatigue is access to the right information and the support. And that's why I started my Facebook group, Healing Adrenal Fatigue Holistically. It's built around my core healing programs for adrenal fatigue. So by all means, join that group. It's open to the public. Suzanne will post the link in the comments and come check us out. I also want to introduce a core program that we're almost ready to launch. One of my pet peeves is that people don't have the finances to get the care they need. But I'm going to have a special announcement about that core program, which is essentially a self-led program. And we're gonna talk about that towards the end. So please let us know. And if you have questions on the fly, put them in the comments. We'll do everything we can to get them on the document, and we'll dig into all of it. And keep an eye on the comments, because Suzanne will be posting links for a call with my patient coordinator or my symptom assessment tool. All that stuff will be available there. So welcome everybody. Without further ado, we're going to dive in. All right. Lena says, is adrenal fatigue due to stress, anxiety, and Epstein-Barr virus, or EBV, or is stress, anxiety, and Epstein-Barr due to adrenal fatigue? It is the latter, Lena. I'm glad you asked that question. I believe I have all three. I don't know how to address them all at the same time. I've been seeing a naturopath for about 2 years, and he says, I just need to fix my gut. And that's what we're taught. Heal the gut, right? When in doubt, heal the gut. And there's a lot of doubt around this condition because the symptoms are so diverse. It affects so many different organ systems. There's so many different symptoms. So sometimes that overwhelms people and they're like, oh, I'll just treat the gut. That's what I was taught in school. That doesn't really work because your gut is going to be associated and strongly connected to your stress physiology. So to answer that question, Lena, it's the adrenal fatigue is really a broken stress response system. Now I've done a bunch of videos on these. You can check that out on YouTube, but there's three components to your stress response system: hormones, nerves, and the limbic system in the brain. The hormone side ends in the adrenals. There's no good name for all of that, this broken stress response system, but that stress response system controls your entire physiology. And when we're in stress physiology, we'll feel the symptoms of stress physiology: fatigue, pain, anxiety, depression, brain fog, and the like, all those things. And at the same time, our body's kind of geared up towards fighting a tiger. We're going to suppress a bunch of other stuff that's really non-essential if there's an actual tiger in front of us, notably immune, digestive, reproductive, thyroid. So my Epstein-Barr used to reactivate all the time. And I had some really wonderful naturopathic doctors, and we would chase after Epstein-Barr again and again and again until I finally realized everybody in the country has Epstein-Barr. It's 95% of us will test positive for having had that infection. Why on earth was mine reactivating all the time and not somebody else? So once I figured out that the immune system is controlled by this stress physiology, I stopped chasing Epstein-Barr, fixed that stress physiology, aka adrenal fatigue, and then I didn't have to chase after Epstein-Barr anymore. So really, you don't have to chase after all these random things. You got to focus on that deep underlying cause. And if you're stuck and you're needing guidance, again, my patient coordinator, Christine, we offer a complimentary call with Christine, and she is one of the most lovely, compassionate people who will kind of listen to your story and talk to you about the ins and outs and how we go about fixing this stuff. But by all means, stick around, listen, and learn. It's easy for doctors to get caught up and chase the symptoms, right? Take this for your pain, take this for your anxiety, take this for your depression. And you could do it in conventional medicine or alternative medicine. Or they chase after these secondary problems, right? The immune stuff, the Epstein-Barr, all the gut stuff, and all those things. Trying to fix those systems while your body is purposely suppressing them is like trying to push a car that has the parking brake engaged. I mean, you get enough behind it, you'll get her to go, but boy, it's a whole lot easier to release that brake, right, and get it to shift. Trying to fix these symptoms or covering them up. I mean, if you're lucky enough to pick the right drug or herb, you might cover up the symptom, but all you've done is kind of put a little piece of tape over the check engine light in your car because you haven't fixed the underlying problem. You just don't see it anymore, and that problem is going to get worse over time. So I would strongly advise you to fix the underlying problem because you can fix it, you can shift this physiology, and then you don't have to chase after this stuff anymore. It happens. It happens. All my best. Holly says, can correcting adrenal fatigue reduce blood pressure? It can. It can. One of the most notable experiences I had was with a patient that had hypertension for 10 years. She was on 3 different medications, and we got going, and she dove in. She was diligent and compliant and did just about everything that we talked about. And within 4 months, within 4 months, she started getting lightheaded. She was still on those medications. Her blood pressure came down and balanced out. She was getting lightheaded and kind of pre-syncope, fainty. She didn't need those medications after 4 months of care. Now it's pretty fast, right? But one of the key components to elevated blood pressure is the fact that every stress hormone you have is a vasoconstrictor. And if you dump a bunch of vasoconstrictors, now your heart's got to pump against a narrower tube, and that pressure is going to go up. It's kind of physics. That's the way it works. If we fix that stress physiology, decrease the vasoconstriction, get those blood vessels to open up, the blood pressure can normalize. So a lot of my patients have low blood pressure, especially in the beginning, but eventually over time, that blood pressure can go up. So it's strongly connected. Now, can I tell you specifically that your elevated blood pressure is from adrenal issues or this broken stress response system? No. But if you wanted to find out, go to my website or click the link in the comments. Suzanne will post a link to my symptom assessment tool. It's on the website. It's a 4 or 5 minute test, and it talks about all the other symptoms that are associated with adrenal fatigue, and it'll give you the likelihood of you dealing with adrenal fatigue. And certainly if you are, then that's what you want to focus on and fix. Okay, Autumn says, I have mixed connective tissue disease, autoimmune. I'm on birth control, the shot. Not crazy about shots for birth control. Been on my cycle since July 14th. That's over a month. That's not good. Feeling very lethargic, fatigued, and not sure what to do. Okay, so if you've been bleeding for a month, chances are there's some kind of an anemia going on, and you should probably see a doctor about that and get labs and tests. Typical CBCs, iron panels, and ferritin, things like that will help you to understand if you're anemic, because certainly anemia, having low iron and anemia is not going to make anything any better. Mixed connective tissue disease is an autoimmune disease, which is an immune system problem, right? And the immune system is controlled by this stress physiology. So the key here is to fix that underlying cause and get at that stress physiology. That's one of the biggest issues. But you've got acute situations going on, and you've got to deal with that acute stuff. And I would advise you to do so and figure out. So certainly you want to deal with, the excessive bleeding, but then figure out, why did I have the excessive bleeding? And certainly stress physiology is going to mess with your ovarian hormones in a very powerful way. This really is the underlying cause. This stress response system thing, right? What we call adrenal fatigue, right? But it's your stress response physiology. It's the control knob for the rest of your organs. It'll tell your organs what to do. It'll tell you whether to sweat or not. It'll tell your pupils to dilate. It'll tell your blood vessels to constrict or dilate. It'll tell your gut to work. It'll tell your immune system to work or not. It'll tell your heart how fast to beat. It'll tell your lungs how fast you need to breathe. I mean, it controls everything. And when it's overused over time because of some genetic predisposition, just enough chronic stress over time to overwhelm those genetics, it gets trigger happy. We as humans are far better at fight or flight or stress physiology because that's our survival mechanism, right? That's why we're all here, still on this earth, because we're really good at that. And those of us with adrenal problems, I mean, we tend to be cut from the same cloth. We're just better at filling up our bucket than the average person, right? We're the doers, right? We care about what we do, so we tend to do things well. And then people come to us because we do things well, and that feels good. We get pats on the back, and then we do more things well. We do too many things well. We become overachieving perfectionists, type A, right? So we're better at filling up our bucket. That's part of what we have to address, is that tendency. We got to create space in the bucket, because it's with space in the bucket that we can get this physiology to shift, which means we're not suppressing all these other vital organs. So, good luck with that process. Jasmine says, does high levels outside of the normal range of DHEA lead to adrenal fatigue? Okay, so DHEA or DHEAS, which is just sulfate, DHEA is one of the main adrenal hormones. So high DHEA doesn't lead to adrenal fatigue, but certainly stress will lead to high DHEA. When we get stressed, we release stress hormones, so cortisol, adrenaline, but also we dump extra DHEA. I hear DHEA and testosterone used synonymously at times. They're not, but they're different based on my lab results, because they're different. I have a difficult time understanding the difference. So DHEA and testosterone, they're both in the class of hormones that we refer to as androgens, which are more male types of hormones. Now, both men and women have testosterone, both men and women have estrogen, certainly both men and women have DHEA at varying levels. In women, a lot of a woman's testosterone comes from the adrenals in addition to the ovaries, okay? Now, when the body's stressed, it doesn't care about testosterone, right? So when our body is stressed, it's geared up for a tiger, right? It doesn't care about your immune function, digestive function, ovarian function, thyroid function even. And even within the adrenals, your adrenals aren't going to produce testosterone because there's a tiger. Who cares about your stamina? Who cares about your sex life? Like, none of that stuff's important. You need cortisol. And then DHEA kind of goes and mops up after the damage cortisol causes. So that's the problem, right? If your DHEA is high, chances are your body's in stress physiology. And and that's an issue that you want to pay attention to. For sure. You can get it all tested. I'm not crazy about blood work for the adrenal hormones. I tend to recommend saliva testing for that. There's one lab that I really like to use. They've been doing it the longest. I find it to be the most accurate, and it's a much more comprehensive test. But you want to test everything within the adrenals to get a better understanding of what's going on. And unfortunately, the adrenals are the only part of the stress response system that we can easily test for. But there's also pituitary stress hormone, hypothalamic stress hormone. You got the autonomic nervous system, which is hard to test for. They do tilt table tests and things like that, which is the most miserable test you could possibly put yourself through. If anybody recommends a tilt table test, I would decline the offer. And it's hard to, test the limbic system in the brain. But when all those are triggered, it ends up at triggering the adrenal. So at least we can get that information. And with that information, we can kind of peek through this window and see what's going on with the rest of the stress response system. But it is more than that. So hopefully that helps. But keep looking for answers, Jasmine. They're out there. Karen says, can you take salt if you have high blood pressure? Well, if you have high blood pressure and you have adrenal problems, the answer would be likely yes. Salt-sensitive hypertensive. The first thing everybody recommends if you have high blood pressures, they pull everybody off of salt. They're partially right. The salt, purified sodium chloride in table salt, or the sodium that's in all these processed foods, that stuff's not good for you. But if you've got adrenal problems, you might need salt because one of the other hormones in the adrenals actually helps you to hold on to salt. And salt or sodium is critical at a cellular level for cells to function the right way. We have to have adequate sodium. But you just want to be smart about it, right? If you're going to increase your salt, then, what I advise my patients to do is go slowly. Maybe start with, you want to get in on the refined sea salt. So a healthier sea salt, Celtic, real salt, pink Himalayan salt, you put a little on food, and then you can incrementally build it up. There's a couple signs of low salt or low sodium that are real common for patients with adrenal problems. Frequent urination is a big one. So if we can't hold on to salt, we can't hold on to water. So my patients just pee it all out, and that can affect blood volume. That can make us lightheaded. So frequent urination, lightheadedness. Problem though, those symptoms are annoying, but the bigger issue is that now you're going to be chronically dehydrated, not just superficially, but at a cellular level. When cells are dehydrated, they don't work. They just don't work. Everything kind of grinds to a halt. So that salt thing is really important. Okay, so more, how should I take the salt and water? Should it be dissolved? Yeah, food and or water, most of it will dissolve unless you super saturate it. But yep, that's the easiest way to go. And heard you should not be taking potassium if you have adrenal problems. So could it be an issue if you're on blood pressure meds that contain potassium? So some blood pressure meds deplete potassium. And so that's why they add potassium back. So you kind of need that potassium. Your adrenals control a ratio between sodium and potassium, and it depends on the stage of the condition that you're in as to which you're going to tend to need. In the earlier stages, it actually flips. You kind of need more potassium, less sodium. In the later stages, you need more sodium, less potassium. That's where the testing comes in. The testing is pretty crucial here to find out kind of exactly what people need. Pardon me. Okay, welcome everybody. As you join in, let us know in the comments where you're from. We're always curious. And if you have any questions, put them in the comments. We'll try to get them on this long list of questions that I have on this document. I'll do my best. Renee says, I see 3 different magnesium options on your website. I'm wondering how to know which type of magnesium is best for me. Are there guidelines on which variations are better for certain situations, sensitivities? Thank you. Okay, so when you take a mineral, it's going to come in a salt. So chemically, a salt is just kind of 2 minerals combined together, right? Like I said, sodium chloride, that's a salt. Potassium chloride, magnesium citrated salt. They're just 2 different things that are combined together. They don't exist by themselves. But what the body does when you add that, it splits it apart. So when you take any magnesium, if it's a citrate, glycinate, taurate, malate, aspartate, there's a ton of them, right? When you take a magnesium, you're going to get the benefit from the magnesium, and then whatever that other moiety is, you might get some benefit from that. So commonly, magnesium citrate is probably one of the most common ones that I'll use. It's relatively inexpensive and easy to get. There's also magnesium glycate and magnesium taurate that I'll use sometimes, which means you get the benefit of the magnesium, but you also get the benefit of the glycine or the taurine. Glycine and taurine, these are amino acids that actually work in the brain, kind of calming types of amino acids. Taurine has a little extra benefit for cardiac stuff, so maybe I'll use that in a patient with cardiovascular disease or some heart issues. If somebody needs a little more calming, the glycinate, that kind of a thing. And, magnesium's a fairly common deficiency with regard to this because stress physiology uses it up. Stress physiology uses up a bunch of stuff. B vitamins, a lot of your minerals, including magnesium, depletes our antioxidants, that kind of thing. So magnesium can be helpful. Typical dosage range is probably in the 300 to 500 milligram range on average. Sometimes more. If you take too much magnesium, it'll loosen your stool, and then you just back off. Is typically my recommendation. Okay, Caroline says, hi, is PCOS linked to adrenal fatigue? Can adrenal fatigue cause headaches and muscle aches? Okay, so the last question is easy. Yes, it can cause headaches and muscle aches of all kinds. It messes with our metabolism, mitochondrial function. 3 most common causes of headaches in this country are stress, dehydration, and low blood sugar. All 3 of those are associated with the adrenals, direct connection. Stress, of course. Dehydration is that salt conversation that I just had, and blood sugar, right? So the main job of cortisol is actually to help to raise your blood sugar if ever you miss a meal. And certainly that can trigger a headache. Again, the adrenals are responsible for that. Ovarian problems of all kinds are going to be associated with stress physiology and adrenal issues, including PCOS. So we know that stress physiology, those stress hormones go to the hypothalamic pituitary ovarian hormone axis and suppress them. And they throw them off balance. Now, it depends on kind of your unique biochemical individuality as to what that's going to look like when your ovaries try to do their thing. Most commonly, it's kind of an estrogen dominant kind of a picture, heavier periods, worse periods, worse cramping, PMS, PMSD, all those kinds of issues. But sometimes it can be bad enough to lead to fibroids and fertility issues and endometriosis. And PCOS comes with kind of the extra androgen side of things, those male dominant hormones. But yes, it absolutely is connected. And certainly I will target the adrenals, balance that physiology so that now your stress hormone is not bombarding that gonadal hormone axis or that ovarian hormone axis, and it has a chance to kind of normalize and balance out. So there is a strong connection. Okay. YouTube comment. You know you like it says, can MTHFR cause adrenal fatigue? No. So MTHFR is, one of these genetic tests. Now that we have the Human Genome Project and we can do all these genetic tests, people get all excited about all these various genetic SNPs. MTHFR is so incredibly common in the population. I just pretty much assume everybody has it. But everybody doesn't have adrenal problems. MTHFR is kind of a methylation defect. You could bypass that with some methylated B vitamins, but it doesn't cause the adrenal fatigue. In fact, the adrenal fatigue and stress physiology can cause the MTHFR to express itself. We have to be careful when we go to genetics, because whenever you have a conversation about genetics, you have to have the other conversation about epigenetics. I did a whole video on this. It's on YouTube about epigenetics. And that's a really important conversation because the genetics are the blueprints in your body, but we don't read all those blueprints. All cells have all these blueprints, but we don't read them all at the same time. Epigenetics is which blueprints do we read at any one time. And depending on your physiologic state, like if there's a tiger in front of you, you're going to read the blueprints about survival and energy metabolism and your fight or flight, right? But when you're in vacation mode, right, and you turn on the healing and repair side of your physiology, your cells are going to read this completely different set of blueprints. So we switch these genes on and off all the time. So be careful. Most of us have learned genetics in like high school, and it's like, okay, do you have, red hair or brown hair or blue eyes or brown eyes or whatever, right, which are fixed. These genetic SNPs are not fixed. They're all about probabilities, and we can change our genetic expression by changing our physiology. And that's an important conversation to have. So don't get caught up in the genetics too much. Hendrik from Belgium, welcome, Hendrik, good to have you. I have 4 autoimmune diseases and myocarditis 4 months ago due to herpes HHV6. Is that because of adrenal fatigue? Now I take prednisone. Okay, so the tendency, so I'll go back to the immune system conversation, right? With stress physiology, adrenal fatigue and stress physiology, we cause the immune system to be out of balance. And what that can lead to is a susceptibility to chronic infections like HHV6. HHV6, other herpes family viruses, Epstein-Barr, chickenpox is actually a herpes family viruses. Most of us get exposed to all of these. Almost all of us get exposed to these in childhood, but then our immune system's strong enough to keep them dormant. So chances are there was a bit of a reactivation. And if we looked into kind of someone's history, usually it's following a period of stress or exposure or some kind of stress. That immune system shift also predisposes us to autoimmune diseases. I've yet to see somebody with an autoimmune disease, and I see a lot of it in my patient population, but who didn't have an underlying adrenal problem that was contributing to it. And when you shift this physiology, you can improve that tendency to that. And what I would recommend is just reach out to us, because we do have these new international programs that we can kind of share. So send us a message, either in the comments or if you get to the Facebook group. And Suzanne will put a link to that. You can comment there and we can provide that information if you want more specific guidance. All my best. Sherry says, I have environmental allergies, taken 2,000 milligrams of quercetin daily for months, haven't noticed a decrease in allergic symptoms. When I take antihistamine from the drugstore, I notice I sleep much better without waking up multiple times a night. Is there another supplement you would recommend for the allergy symptom release while I'm working on healing my adrenals? So allergies, so that's the other component, right, of the immune system getting shifted. We increase antibody production, and when you have that tendency to increase antibody production, you can increase it to anything. So we see environmental allergies in my patients with adrenal fatigue. I see food allergies. You can even develop an allergy to your body's own tissue, which is what an autoimmune disease is. So these tendencies are pretty common. Quercetin is one of the things I like to use. I would say that dose is pretty well maxed out with regard to that. Histamine, so allergies come with histamine, right, which is why we take all these antihistamines. Quercetin is just a natural one. Histamine is also a neurotransmitter in the brain, and it's a neurotransmitter of wakefulness, which is why antihistamines, like over-the-counter stuff, it says don't operate heavy machinery and all that stuff because it can make you drowsy, so it can help with sleep. So there are other natural antihistamines. Certainly quercetin is a good one and a relatively inexpensive one. Lots and lots of vitamin C is a histamine scavenger. Pardon me. Are there others? So there are others. So there are other natural antihistamines. Luteolin is one, which is a little harder to get in a supplement, but I think those supplements exist. I have a couple other herbs that I'll use, natural antihistamines. Kidney, believe it or not, organ supplements with kidney have in them DAO, which is diamine oxidase, which is the enzyme that breaks down histamine. So sometimes a glandular remedy with a kidney glandular, unless you can get kidneys from a local butcher and cook them up and lightly and eat them if you want, but you can get them in supplements as well. So I would go maybe in that direction as far as those considerations. Okay. Ashley says, what does cortisol belly look like, and how can I tell I have it? Any tips to help reduce it? My stomach's more and more swollen no matter what I do. Looks like I'm pregnant. Okay. Cortisol. So cortisol belly is more fat, right? It's fat, not necessarily swelling. So if there's swelling, to me, swelling and kind of feeling or looking like you're pregnant seems like it's more like a bloating kind of a situation. Now that can also happen with adrenal problems, again, because stress suppresses our digestive system and then the digestion's inefficient. We get gas, bloating. A lot of my patients are diagnosed with IBS, and it can cause heartburn and reflux and diarrhea, constipation, you name it, right? Even inflammatory bowel stuff. So you're gonna have to differentiate those two. But cortisol belly is fat, like you can grab it, and it's a real thing. The fat cells in the belly are more sensitive to cortisol. So that's kind of what you're looking at, Ashley. How do I get tested to check my adrenals? Any at-home test kits? There are salivary test kits that you can get. That's what we use in our practice. I tend to like the one that I use because it's much more comprehensive. Most salivary testing will get you 4 cortisols throughout the day and a DHEA. The one that I use has 5 other markers from the adrenals, which are really helpful in kind of putting the whole picture together. But the best way to test for adrenal issues is going to be salivary cortisol testing, which is huge. Now, conventional medicine doesn't, believe in saliva testing for these hormones, which is a little bit ridiculous, because if they were to open up a journal that they should be looking at, those research facilities that study stress physiology and cortisol and all this, they use salivary cortisol testing. It's long since been proven, but it just takes a long time for that information to trickle down to mainstream docs, unfortunately. So saliva testing. And is there a correlation between adrenal health and gut health? Yes, like I just said, specifically GERD. How do I manage? Yeah. So the big thing is, it sounds like you've got a lot going on, and my recommendation would be to reach out to us. Again, complimentary call with my patient coordinator, Christine. She can talk this stuff through a little bit. There's no quick fixes to any of this. And it's common, right? A lot of doctors will chase after those secondary conditions, and they'll treat the gut, they'll treat it again, and they'll treat it again, and they'll continue to treat it. I've had patients come into me, they've been diagnosed with SIBO, which is small intestinal bacterial overgrowth, and they've treated it 3, 4, 5 times, and it keeps coming back. I'm not about creating customers out of patients. And that's kind of what we're doing by chasing these secondary problems, by dealing with the symptoms, by not addressing the underlying cause. We're creating customers, and that's not healing to me. Healing is figure out what you're dealing with. What is the underlying cause? Know how to manage it, get ahead of it, right? And then go live your life. Stay away from as many doctors as you can, including me. So I would reach out. Christy says, if we wake up in the middle of the night multiple times, perhaps because blood sugar dips and the adrenals are being sensitive, are we supposed to eat something or just let it ride to the morning? Yeah, so sleep problems, Christy, are incredibly common with regard to adrenal issues. There's lots of different reasons as to why my patients will have a hard time getting to sleep or wake up at night. Low blood sugar is certainly a big one. The better the blood sugar balance during the day, the more stable it's going to be at night. So during the daytime, you definitely want to eat a hypoglycemic diet. That's all my patients get that recommendation, right? You want to do small, frequent meals, more protein and fat, low sugar and carb. You want to get a snack before bed. Snack before bed's key because that helps that blood sugar overnight. But at times, depends on the severity of the condition, but at times my patients will wake up, their blood sugar's dropped, eat something, right? Nothing big, doesn't have to be anything big, but some kind of animal protein tends to be the best way to go about it. But eat, don't let it ride. Don't let it ride. Eat. You shouldn't have to do that, right? Of course. And when the adrenals heal, you won't have to do that. But if that's where you're at, that's what you have to do. Sean says, just glancing at my time. Okay. Have you seen cortisol levels go from low to optimal, or is mid-range more of a realistic goal? No, optimal is where we're going, Sean. Optimal. That's what we want, and that can happen It just takes a comprehensive approach. That's the big thing. Even with doctors that believe in adrenal fatigue, what I found is when they find it, they just kind of grabbed hold of a tail of something that's way bigger than they anticipated, because it's more than a problem with just your adrenals. It's those other hormones, again, hypothalamic pituitary, it's the autonomic nervous system and that limbic system in the brain. When you treat all of that together, that's when you can get ahead of it. And that, I mean, ultimately, that's what we do that's unique. You have doctors that will identify the dysautonomia or the problem in the autonomic nervous system, and they'll be like, oh, that's your problem. And I'm like, yes, that's your problem, but not only. They'll identify the adrenal issues. And yes, that's your problem, but not only. Some doctors even will do MRIs of the brain. Hey, your amygdala lights up in the limbic system. That's your problem. Yes, but not only. The most efficient way to fix this is to address all of that all at once. And that tends to be what we do in our healing programs that we use. So hope that helps. Pardon me. Okay. Let's see. So Sarah says, I had 2 really good weeks, but the last month I had a lot of weakness accompanied by nagging dizziness. What are some rational things I could do to encourage myself with? Why, even on my better days, does it feel like a small motor vibration never shuts off? Is there more help? Okay. So Sarah, I'll tell you what I share with my patients. One of the scariest things one of my patients can tell me is, in the beginning, doc, I'm feeling better. Because as soon as we tend to feel better, we do more. And our tendency as people who develop adrenal problems, we have a tendency to do too much. So my guess is, and this may or may not be accurate, but when you're feeling better, you're probably doing a little more, living a little more, and then we go too much and we kind of take a little bit of a dip. Now that's par for the course. I mean, that's what healing looks like. The trajectory of healing in my patients is basically, if we graft it, it's up and out. Now, some people have a faster trajectory, some people have a lower trajectory, but as long as it's up and out, you're getting there, but it's not linear. There's these ups and downs and ups and downs and ups and downs. Now, eventually the dips aren't as bad, or dips or crashes kind of in the beginning, they become dips later on, and they decrease and they're a little milder and we can understand more. But the key is to just go back to tighten the reins and go back to all those things you were doing they got you feeling better in the first place. That's really the key. And I would say that motor running, that vibration, chances are that's adrenaline or an upregulated nervous system, which we do want to calm down. Calming is always better. A lot of my patients are wired and tired. They're both. They're wired and tired. And what I've learned in doing this for so long is that we've got to take care of that wired part first. Because if you're trying to fix somebody before they're kind of calm, it's like you're trying to fix the engine of the car as you're still driving it down the road. I mean, you're going to be limited as to what you can do. You want to pull that thing over into the driveway and get it up, and then you can do some work on it. So you've got to deal with that wiredness. That's got to be calmed down. And again, it takes more of a comprehensive approach quite often. Good luck. Let's see. So Dawn says, why does fasting end for me with nausea, mild vomiting, and diarrhea? So I will say, Dawn, that if you have adrenal problems, fasting is absolutely not what you want to do, because of that cortisol issue and because of that blood sugar control. Patients with adrenal problems should not fast. You don't want to do intermittent fasting. You don't want to do time-restricted eating. Now, I'm a fan of time-restricted eating. I'm a fan of intermittent fasting, but not if you're dealing with active adrenal problems. Maybe years down the road, you could do a fast or you could do some time-restricted eating, but you don't want to do it if you have adrenal problems, because you're not going to tolerate it very well. So that's the big thing. So I'll leave it at that. Okay. Carrie says, why is my sleep so interrupted with adrenal dumps? Yeah, so I think I answered that just before. There's multiple reasons as to why we'll dump adrenaline or cortisol, blood sugar being really a big one, but there's lots of other ones. Stress hormone wreaks havoc everywhere. I mean, it damages brain, and it messes with neurotransmitters, all that kind of stuff. The big thing with regard to the sleep is shifting this physiology. When we shift our body out of fight or flight, the sleep is better. So that's really the key. I mean, there's tons of reasons for it. And it starts with testing. I mean, you want to get some assessment. Like, what if your cortisols are high at night? Well, you've got to take some action to fix that elevated cortisol at night. So that's what you got to get to. Marlene says, 2 years ago, ER found 2 centimeter mass on my adrenal gland. Didn't tell me blood work's good, but I have symptoms of adrenal fatigue, which my doctor says doesn't exist yet. They don't believe in it. I'm scared. MRI on the 30th. Should I insist they remove it? Marlena, I would say reach out to us. That's more of a conversation. So reach out to my patient coordinator, complimentary call. You can talk to Christine, and she can kind of help you understand that and navigate that a little bit. The more we look inside our bodies, the more we see weird cysts and masses and things like that. As far as the adrenal gland goes, the vast majority of these are benign. You can rule out any kind of problematic adrenal mass just with typical blood work. So chances are this is just a benign thing, and it could be caused by adrenal fatigue and that stress physiology. Conventional medicine says they don't believe in adrenal. They claim that adrenal fatigue doesn't exist. It's not a thing, because they're taught that as long as your adrenals haven't completely failed, which is called Addison's disease or adrenal insufficiency. It's rare, but it happens. Complete failure, usually an autoimmune process. As long as your adrenals haven't completely failed, then they're fine. That's what they're taught, which doesn't even pass the eye test if you think about it, right? Because logically, like, they'll let you have ovarian hormone problems short of complete failure. They'll let you have thyroid hormone problem short of complete failure, but not your adrenals. Like, if they're functioning at all, they're perfectly fine. It's a semantics problem. What they're claiming is that the adrenals don't gradually decline and ultimately fail and get lower and lower and lower. And that may or may not be true. I mean, I don't agree with that. But what we're dealing with is a stress response system dysfunction. And it is well documented that stress physiology contributes to all these symptoms. And I'll call it adrenal fatigue because we don't have a better name for it at this point, right? But really, it's a broken stress response system. Whether it's anxiety, depression, well documented that stress causes that. It's also well documented that your stress response system can be broken. It can be overloaded. It can be dysfunctional. And when you look into the research, which they don't, but if you look into the research, they'll talk about glucocorticoid receptor hypersensitivity or hyposensitivity or resistance. They'll talk about HPA axis dysregulation. They'll talk about hypocortisolism. So they use these other names. I combine, those are all adrenal fatigue, right? They're all adrenal fatigue. So don't get caught up in the fact that they don't believe in it. Eventually they will, and they'll pay attention to it. Maybe, I don't know, I'll leave it at that. Don't get me started. Catherine says, does consuming organ meats help with adrenal fatigue? Consuming organ meats helps with everything. Everything. We all should, as much as possible, full of nutrients, incredible nutrients, very healthy for us. We've kind of lost that, the art and that kind of that process, unfortunately, over time. This way of traditionally eating, but absolutely, I mean, ultimately, we should be eating kind of nose to tail, they call it, right? Including the organ meats. So, okay, I'm being told I have 15 minutes and I should speed up. I'm going to get to as many as I can. Susan says, many of my extended family have been diagnosed with some form of mental illness, most cases prescribed drugs, psychiatric counseling, and other treatments for anxiety and depression. So how do you address patients with this history? Have you had success with these cases? Absolutely. Most of my patients are treated this way, right? These doctors are looking at the symptoms. They don't see anxiety as a symptom. They see it as a condition in and of itself, or depression as a symptom in and of itself, without paying attention to the underlying cause, the likely underlying cause. And again, it's documented. Right, we know that if we put a rat in a model where they study stress, and they call it a chronic, unpredictable, mild stress, usually restraint. They put them in a little box. Rats don't like to be constrained, so that stresses the rat. That rat will develop depression. Pretty sure that's not a psychological problem for that rat, right? And if you take them out, the depression goes away. It's stress hormone hitting the brain causes a lot of these symptoms. So they're covering up symptoms, and that's fine. Most of my patients are on meds, and they're, I'm for counseling. All that stuff is good, but there is an underlying cause. Just focus on fixing the underlying cause, shift its physiology, and all of a sudden they don't need all that other help. So it absolutely can happen. Diane says, can you relapse with CFS? So take CFS, chronic fatigue syndrome, take adrenal fatigue to the nth degree. Some will reach the diagnostic criteria for chronic fatigue syndrome because they have enough debilitating fatigue. Some will reach the diagnosis. They'll have enough chronic pain to reach the diagnosis of fibromyalgia. Those docs don't really know what that cause is, but it's very well documented that there are adrenal issues and HPA axis dysregulation within those conditions. Can you relapse? Yes, because it's an extreme version of adrenal fatigue. There's always going to be ups and downs. If somebody's been diagnosed with chronic fatigue syndrome, then it's a little further along the condition. So patients that come into me, their functional capacity varies. Some might be as debilitated as 10 to 20%. They could barely do these activities of daily living. Many are in the 40, 50, 60%, and they can function, they can survive, but nobody can see that we're faking it, is where I was. I'm falling apart on the inside, but nobody can tell. I didn't look sick, right? But nobody would see me crash afterwards, right? Nobody would see it. I had to sleep through the weekend, or when I was in med school, I had to sleep through the break in between semesters to be able to get up and do it again. So those are, if you I don't call them relapses, dips, crashes, happens all the time. But it's fixable. It's fixable, but we've got to fix this underlying physiology, because if we have somebody that's stuck in fight or flight and stress physiology causes tremendous wear and tear on the body, and that's where all the symptoms come from, including the fatigue. But at the same time, you're suppressing the healing and repair physiology over here. The body knows how to heal itself. It's been doing it for thousands of years, but not if it's turned off. We've got to turn that physiology back on, and there are ways to do it. So by all means, reach out. Sophia says, why do I wake up in the afternoon after an afternoon nap feeling groggy and hungover? No alcohol, thanks. My fatigue is worse between 2 and 6. If I don't nap, I don't sleep. If I nap, I don't sleep well. Intense nightmares. If I don't nap, I'm too exhausted. Okay, so napping's touchy. It could be the length of time you're napping, so you might want to kind of play with the length of time, even setting an alarm. If you wake up from a nap and you're in deep sleep, you're going to feel groggy. But if you're kind of cycling through and you come up close to waking, you might feel a little more refreshed. So you might have to play with the time or the timing of the nap, early as opposed to late, that kind of a thing. There's a lot to that. But my advice to all my patients is listen to your body. That's really the key. Listen to your body. The body never lies. The mind, however, will lie at the drop of a hat. So listen to your body. Your body guides you through this stuff, okay? And again, welcome everybody. If anybody joined in late, let us know where you're from. We're always curious. Melissa says, what are your thoughts on microdosing with psilocybin to calm the nervous system, extreme stress, 3 deaths, sorry for your loss. Yeah, so we have to rewire the brain always, in everybody. Got to rewire the limbic system. And, some people are using psilocybin, like microdosing psilocybin, to do that, which is a way to do it. I don't have any experience with it. I mean, I'm familiar with the research I've seen some success. I don't use it and my patients get better, but it's just another way to do it. It's another way to do it. So I've got to leave it at that. Lisa says, I've heard from a few different sources lately that certain deep breathing exercises can actually make anxiety worse. I want to avoid any techniques that can make anxiety worse, of course. Please explain. Okay, so breathing, there's lots of different breathing exercises out there. The big thing with breathing exercises, if your exhalation, no matter what it is, if your exhalation is longer than your inhalation, you're going to be turning on your parasympathetics. That's kind of what does it. There's a famous one called the 4-7-8 breath that Andrew Weil made famous. In for 4, hold for 7, exhale slowly for 8. Exhalation longer than inhalation. That will do it. There's the physiological sigh, which will also do it. You can just kind of Google that stuff. There's certain like Wim Hof breathing techniques and things like that, like rapid breathing and things like that that you don't want to do. But again, I would say you just listen to your body. If you do a relaxation exercise of any kind that you don't feel right doing, pick another one. There's tons of them out there. Okay. John says, I'm sure we all really like to know just what led traditional medicine to the shocking view that any adrenal function at all, no matter how small, is adequate for the human body's needs and therefore shouldn't be investigated. How and when did the research and practice ever become so badly skewed? Thank you for all you do. Well, thanks for that, John. I think I answered that earlier. It doesn't make sense to me either. There's reductionist thinking in medicine, unfortunately, and like if we break things down to the smallest bits, we can kind of figure things out, which is fine, and we need to do that. I mean, technological advances have been really powerful that way, which is wonderful, but we also have to zoom back out, right? So we want to zoom in, right? And then we want to zoom back out. A lot of these doctors, they get really good. It's like that fable, the parable with the 3 blind men standing around an elephant, right? One's at the tail, one's at the ear, one's at the trunk, and they're all describing in exquisite detail what they see and what they feel and what they sense, and they're all right, but nobody's able to help to unblind these men and step back and be like, look, this is an elephant. That's what we're dealing. We're literally dealing with the elephant in the room that's contributing to so much chronic disease. Adrenal fatigue, stress physiology, it'll cause cardiovascular disease. It'll contribute to diabetes, metabolic syndrome, right? Insulin resistance, weight. It'll contribute to cancer. It contributes to autoimmune disease. A lot of these psychiatric diagnoses, anxiety, depression, stress physiology contributes to all of that. I mean, it's profound. There's a lot to it. But, those conditions, they end up treating them like they're a condition in and of themselves, that they just came out of nowhere. Oh, maybe it's your genetics. Like my elevated blood pressure I had when I was in my 20s. So why do I have elevated blood pressure? I'm in my 20s. I should be in the prime of my life. Genetics, he said. Genetics. I'm like, all right, well, I got a little cardiovascular disease in my family history. That makes sense. I didn't tolerate the meds. But lo and behold, when I discovered the adrenal problems and fixed that, I didn't have high blood pressure anymore. I should have gone back. Like, what did I do? Change my genes? No. So it's a cop-out, right? The genetics conversation is a cop-out. There's more to it. It's just semantics. So it is appropriate information. Okay, so I want to talk about core real quick, and then I'm going to jump back to the questions and get to as many as I can. My core program, for those of you that have been anxiously, easy for me to say, awaiting the release of this self-led adrenal healing core program. So it is about to be released, and it's going to be released at a kind of the lowest price possible for a temporary period of time. One of the things that drives me crazy is the fact that patients can't access the care they need because of finances. So what I've done is I've documented all the advice I used to give patients who used to come and stay with us at our guest house and work with us for a couple of weeks, couple of months. I've documented all that information. I put it into educational modules, and all of that information is in there in this core program. So it's a self-led program. That's the big thing. But I'm going to make it available to everybody everybody for a limited time. So if you go to my Facebook group, Suzanne will post the link to the Facebook group. She's going to post that there to that community. So jump in there. It's a public community. Join the wait list when you're in there, and we're going to release that. It's coming up soon. It's technical stuff. I've done my job. They're putting it together. They make it pretty. It's there. So that's core self-led program, all the information you need to heal and get back on your feet. Okay. Margarita says, how to balance blood sugar completely, how to lower my cortisol in the morning, any supplements. Yeah. So, how to balance blood sugar basically by working on by using the hypoglycemic diet, right? That's the biggest thing. So small, frequent meals, more protein and fat, low sugar and carb. The thing is with blood sugar, your adrenals should be controlling your blood sugar, right? We shouldn't have to eat a hypoglycemic diet. Like I said, most people don't feel as miserable. They don't have to eat every 3 hours, right? They don't have adrenal problems, but we do. Your adrenals should be able to respond in a very measured, kind of dynamic, nuanced way to those blood sugar issues. So that's really the key, right? First and foremost is that hypoglycemic diet. And then learn, right? You learn if your blood sugar drops, it's going to be one of those three things. Did I go too long without eating? Did I have too little protein and fat? Or did I have too much sugar and carb? That's a big thing. There is a supplement that I tend to use for blood sugar issues called Berberine. And Berberine is a plant extract from a few different medicinal plants, been used traditionally for thousands of years. And one of the benefits is it helps the way our body takes energy from food and turns it into fuel. And strong research, metabolic syndrome, insulin resistance, even diabetes. But that's one of the things that can help with blood sugar. I tend to use that a fair amount in my practice, just FYI. Irene says, I'm facing the choice between starting methotrexate for my RA or holding off trying to heal the holistic way. Former CFS patient, once healed by Dr. Posnecker. Shout out to Dr. P, is my predecessor. Can the two treatments be combined, or is there a holistic method? Is it compromised by using methotrexate? The treatment methods can be combined. But again, like I said, I see autoimmune diseases of all kinds, including rheumatoid arthritis. And the challenge with the treatment, conventional treatment for autoimmune disease, all of them, is they don't pay attention to the why, right, of the problem, right? They just use a sledgehammer to suppress the daylights out of the immune system, and then we're stuck with a suppressed immune system. So that's really the challenge. I have numerous patients who we've worked with, and little by little, their autoimmune disease improves. And you can target the immune system in a more delicate way as well, which I will often do when I have patients with autoimmune issues, as opposed to just, it's like driving a little finishing nail with a sledgehammer, as opposed to like a little finishing hammer, a little tap, tap, tap. Like we can tap, we can target. So that would be my recommendation. But you don't have to do one or the other. I try to treat as conservatively and work at the underlying cause as best I can. So we're right about out of time. And I apologize if I didn't get to your question. We're doing these regularly, right? So I've got your question. It'll be on for the next one. Just, keep a lookout for our information. Reach out in the comments if you want to get any more information. Go to that Facebook group, that Healing Adrenal Fatigue Holistically. You can take a look on my YouTube channel. I've got hundreds of videos on there now where I talk about a lot of these things and some of the nuances. It is my deepest desire to get the right information out to everybody about this incredibly misunderstood condition. So we keep answering questions. We keep putting information out there so that people can get accurate information. By all means, follow us on social media, whether it's TikTok, Facebook, Instagram. Go to YouTube, follow us, like us, comment, share the information. By all means, trying to catch people as early as possible in their process, because people will go through. I hear what patients have been through as far as treatments go. I field new patients all the time, and I hear their stories, and I hear the specialist merry-go-round that they've been on, that I was on, right? I hear then, if we give up on that, then we go to conventional medicine. I hear all that stuff as well. They go to alternative medicine, right? And they chase after, again, they're heal the gut and everything gets better, or we'll throw you on hormones, or we'll fix your immune system. You can't fix those things unless this physiology is shifted. So I would implore you, don't only chase after these secondary problems. Don't only chase after these symptoms. A little symptomatic support's fine to survive the process. But when you fix that underlying cause, that is really the key. That's how you truly truly get ahead of it. Okay. Am I supposed to do that last question? I think I'm done. Oh, last question. Okay. One more question. Okay. Kathy said, this is a long one too. Geez. Be curious about my organ health, brain, heart, kidneys, ADHD, naturopathic gave me a test about neurotransmitters off, monitor bradycardia, weight, worried about kidney function. You mentioned aldosterone. As in your video, I have chronic stress as a norm. I do have issues processing cortisol according to DNA. Yeah, don't. Connections between other. All right. So Kathy, there's a lot going on there. It does sound like you have adrenal problems, and it's those adrenal problems that lead to the cortisol problems that lead to the neurotransmitter problems. And that's what everybody's kind of looking at. My recommendation is to reach out to my patient coordinator, Christine, complimentary call, have that conversation with her, and she can talk to you about options and what makes sense, what makes sense moving forward and what that looks like. I know that's a lot. It's complex. The treatment doesn't have to be so complex. You don't have to know this stuff in and out like I do, but you darn well better have a doctor that does. That's what fixes this thing. Know what to chase after. What can I let go of, right? What do I have to focus on, right? Because there's a lot to it, right? You need a framework. All patients need to figure out how to put together their individual therapeutic puzzle. There's some couple basic pieces of that puzzle, which I talked about today, which is good. That's helpful, right? But even those pieces the orientation is a little different. The size is a little different, right? But everybody's puzzle is a little different. And, I went to med school to put these puzzles together. I studied under Dr. Posnecker, right, who was a puzzle master with regard to this condition. Plus, I've been putting these puzzles together for over 20 years now with thousands of patients, perhaps just like you. So it's okay to need help. If you need help, you need guidance, you need support, reach out. We're here. Okay. All my best, everybody. Bye.